Hello, welcome to my lab. I have already gathered all the necessary equipment that I need, which includes my tourniquet, my gloves, my 70% alcohol swab, cotton tape, my shorts container. I have 5 vacutainers. I've got one for my discard. I've got a light blue, that's for PT. I've got 2 golds. I've got one for the troponin and one for the CMP. And then I've got the lavender for the CBC. Um, I've got the labels, and I've got my transport bags. I've got the frozen bag for light blue, which is our PT, and then I've got the refrigeration bag for the 2 golds and the lavender. I've already identified my adult patient who is conscious. They've verified their name, first name, last name, date of birth. I've introduced myself. I've checked the lab forms against their wristband along with their name and date of birth that they provided, and they all match. I've asked the patient if they have any allergies, especially any allergies to latex. They do not. They've never had a fainting spell. They have no phobias. So they're not nervous at all. They've done this before. I've discussed the test, and I've gotten consent. So the patient is supine. I have a clean paper towel that's placed under their arm. I am inspecting their anacubical medial, and I've located the vein I'm going to use. So I will apply my tourniquet about 4 inches above that site. With my tabs up so they're out of the way and I can release easy. I will perform hand hygiene and don my gloves. Okay, I'm going to clean the site starting from the middle out. Then I'm going to let that dry. I'm going to hold the patient's arm with my non-dominant hand, and using my thumb, I will hold the vein and pull down on the skin so it's tight. I'm going to go in at a 30-degree angle, and it's going to be a swift motion. I'll let the patient know that he'll feel a poke, and I'll know that I am in when I've got the flash. Okay, so I'm going to just collect my 2 milliliters of my discard. Light blue, that's for a PT test. I'm going to collect 2 milliliters for that. I will invert it a few times, and I will place it in my rack. The first gold tube is for my troponin. That's going to be 3 milliliters I'll need. Invert, put in the rack. Second gold tube, this is going to be for our CMP, and we'll need 4 milliliters. Invert, and in the rack. And our last one is our lavender. This is for our CBC. We're going to need 4 milliliters. As soon as this goes in, I'm going to release the tourniquet. And once I've collected the 4 milliliters, I'll invert and I'll place in the rack. With my gauze and my tape that's already stuck on there, because this is like the 5th time I've done this, I will apply pressure, pull out, and immediately dislocate. I'll have the patient put pressure on there for a few minutes. And my labels, you will fill out while the patient is here. It will have their first name, last name, their file number, their date of birth, and the date and time of collection. Once these are all filled out, I will place them on the tubes as needed, and I will have the patient verify that all the information is correct. We'll do that with all 4 tubes. Once we're done, we'll put them in the correct bags. So our light blue one is our frozen sample, so that's going to be 2 milliliters in that bag. And our refrigerated bag, there'll be 3 milliliters for our troponin, which is gold, 4 milliliters for CMP, which is gold, and then the lavender for CBC, which is 4 milliliters, and that goes off to the lab. I will then clean up my area as needed with hazmat or just in the regular trash. I will make sure that my patient is good and comfortable, and that they have their call lights, and that I leave them in a good state of mind. He's ready for a nap, so he's good. I will doff my gloves and perform hand hygiene.